you look dry. You're blinking.
Yeah, I have to show you what I have to do.
Yeah. Are you using any drops?
They put the drops in.
Sorry, at home. Are you using any artificial tears?
Yes.
Okay. How often are you doing it?
My wife does it because I poke my eyes.
Oh, do you? You can't do the...
I'm not his wife. I'm his daughter.
And my daughter.
They're both your bosses, though.
Yes. And he better not forget it.
Yeah. Alright, let me walk through some testing you did, okay? I'll check your dry eyes, too. But you have something called glaucoma suspect. Does that sound familiar? Do you have any family members that have glaucoma?
No.
It seems like you told your prior doctors that you have a family history of glaucoma.
Well, maybe my wife knew my mother had it.
Your mom.
Yeah.
Did your mother have any eye drops or surgeries because of...
Yeah, she had eye drops.
Every day?
Yeah.
Lower her pressure, eye pressure?
I don't know about that.
Did she go blind?
No.
Okay. But she saw the eye doctor pretty frequently.
She did? She saw the eye doctor frequently?
I remember that we gotta get her eye drops. She always says, I have to get my eye drops.
She lived for several years in a nursing home. So
Okay.
I'm sure she was treated there.
No problem. Okay. Have you seen us multiple times or just twice?
I'm sorry?
Hey, how many times have you seen them here?
The eye doctor's here.
I think this is
Twice or multiple times?
twice.
Okay, gotcha. Okay.
See, I got a pair of glasses last year.
Yeah.
And I had trouble seeing it out. So,
What's glaucoma from? Diabetes?
No, it's a complete different disease.
Okay.
I'll explain to you in a
Okay.
bit. So it's hard to explain right now, but this imaging, this is your eyes last year, this year. The only thing I want you to see is, you see that yellow part? That's your left eye superior quadrant. It's telling me it's a little thinner than your last visit. Your last one was green. I'm not sure if I can convince you here, but this is a heat map of the thinness.
yeah.
It's a little hotter there, meaning it's a little thinner. Okay?
Yeah.
And you did the button clicking test today, right? Where you saw the lights in the periphery and you have to click the button every time you saw the light. That left eye, you're missing a little corner near your nose on the bottom, on your left eye.
Really?
Which corresponds to the thinning. So I am a little suspicious about glaucoma, especially given how classic that looks.
What's the test for that?
So this is the test for glaucoma.
Oh.
This shows us what you're missing. So this is your left eye. That's the natural blind spot everyone has. People don't see anything in that little circle there. Okay? But here in the nose, people do see that, but you're not seeing it. I think it's because of the glaucomatous damage you have. I'm not a glaucoma expert. I'm going to talk to someone smarter than me. We'll likely ask you to come back and see the glaucoma specialist. Okay? Let me check your pressure too, because glaucoma is a disease we're not really familiar with, but it starts with loss of vision peripherally. Most people don't even realize it until they lose so much you only have your center vision, and some people eventually lose everything.
Is that wet or dry?
That's a different disease. That's macular degeneration.
Oh.
That's a completely different disease.
Oh.
Yeah. Yeah, so the only thing we can control for glaucoma for patients who have them is the eye pressure. Let me measure your eye pressure, okay?
Yeah.
Yeah. Okay, I don't want to scare you, but that is new though.
Well, you did.
Yeah.
Okay. It's just early signs, okay?
How long does it take to progress, or does it depend on the person?
Depends on the person. If the pressure.
But on average.
Yeah. Our goal is to slow it down enough that the disease never takes away the blindness before the person lives their full life.
Okay.
Okay.
And how do you slow it down?
By
Medication?
eye drops. If it comes to there's eye drops, lasers, and then if worst comes to worst, surgery. Okay. But you're in the very early stages, in my opinion. I'll have someone else talk to you about that. Okay.
Okay.
All right. Let me look at your eyes. We'll do a thorough eye exam. Okay.
Okay.
Okay. Let's take a look. All right. Let me stay right
Okay.
there.
Oh, you want?
No, stay there.
Yeah, I got it. Don't worry. Let's find my chair. Oh, sorry. How's that? Good height?
You want to go in here?
Yes, please. Is that okay? You don't look comfortable. How can I make it more comfortable?
Yeah, you look very uncomfortable, Dad.
Yeah.
Oh, there.
There you
Higher, Dad?
Yeah, a little
go. I
higher.
think your forehead has to touch that, so maybe a little lower actually. How's that?
Oh, okay.
Better? Are you guys local?
He's in Central Square.
Okay. That's less than half an hour, right?
Yeah.
Who did your cataracts?
Uh-huh.
Look at my ear. Good. Keep looking at my ear. Right here. Sit back. Sit back for me.
How's the cataract look?
The surgery looks good. You have a slight film that is starting to grow on the right side from the bottom, on the left side from the side, but it's not quite in the center of your vision, so we don't have to laser it.
Okay.
So the lens we put in can grow a slight film after, but once it evolves into the center, we shoot a little laser to clean the window. But right now you don't need it.
Well, he when he puts it in,
Mm-hmm.
side, he went, oops. And I heard him.
You said, oops.
Yeah.
Oh my God.
So I
It
said,
looks good.
Oh jeez. You don't want to hear a doctor say that.
I know.
No, it looks beautiful. Look up for me. I don't think you're supposed to remember anything from surgery, by the way. You get some sleepy juice.
What's that?
All the way right.
Anesthesia.
Yeah. I don't know if you heard that correctly. Look down. Look down. Look left.
Up.
Left.
Left. He has a hard time hearing.
No worries. Up for me. Right. Down. And left. Oops, sorry.
That's right.
Okay. One last thing, we're gonna measure your eye pressure, okay?
Were you in the military?
I was not. Why?
I just wondered if you worked here.
No.
You'd be in the military. I didn't know what the rules were.
Oh, if you have to be military to work
to work
here.
at the VA? No,
Yeah.
no. I think you have to be an American citizen, though. Look up. I don't think there'll be enough military doctors to cover this place.
Yeah.
Nothing went in my eye.
I know. I missed. You blinked.
Me too. When I do it. I
Maybe he
poke
should
my eye.
tilt his head back further.
Yeah, I think we need your
Dad,
right.
tilt
There you go.
further.
There we go. And I'll hold your eyelid. There we go. Ready? Okay.
Stings a little, huh?
Yeah, sorry. I should have told you that.
That's all right.
Okay, so that will tell me if your eyes are dry, and also it helps you measure your eye pressure because it numbs it.
Oh.
Yeah. So you're not on any eye drops. You never had eye surgery other than the cataracts, correct?
Let me think before I answer.
Okay. You're not on any eye drops though,
No.
right? Okay. What eye drops? The artificial tears only?
Yeah.
Okay. You know if that's true.
I don't know. You
It's-
take
It's a little thing you
It's just
squirt in there. It's supposed to.
moisten your eyes.
Well, you have ducts in there that plug up with chicken fat as you get older, and it takes it out.
that's
I
not
cl-
good.
I don't know what he's talking about.
It's probably artificial tears.
Okay.
We'll take a look.
Probably does. Yeah, that makes sense because it's he's the way he's saying it, it flushes it out. So that would mean that he would receive
All right, right this way, please.
generate tears, I guess.
Yep. Make sure your forehead's touching too. Good. So this part, I don't know if you had this done. This will gently touch the front of your eye. You're not gonna feel it.
Puff.
No, it's not a puff. It's I will touch you.
Oh, okay.
Yeah, but you won't feel it. Maybe your lashes will tickle. All right, look right here for me, okay? And let me do all the moving. Okay, and now look right here. Your pressures are beautiful.
Oh, that's good.
Yeah. Blink. back for anything? Oh, you're okay. Okay. So testing, like I said, we do have a new visual field finding, but obviously this is the first time we did that test. Whether we're gonna start drop therapy or not, I will talk to my boss, Dr. Grunstein. We'll likely have you repeat that test just to make sure it's a real spot that you're missing. Okay? Because your pressures are so good, I'm not sure if you need to lower it right now. Does that make sense?
Yes, it does. The thing is with that test, the light is very dim.
It is, yeah.
Is that normal?
Yeah. But you were a good test taker. The computer said you weren't missing any spots that you're supposed to see.
Did I say that?
Yeah.
Because there were some spots I didn't know if it was imagination
Yeah.
or not. you
Good,
know?
good. The machine tries to trick you, by the way. Sometimes it doesn't show you a light, but it makes that noise
Uh
to test if you're just clicking from the noise or not.
Yeah,
You didn't fall for it.
no.
huh. I'm not
You're a
surprised.
good test taker.
Hey, did you come from China?
I came from South Korea.
South Korea?
Yeah. I lived most of my life in Canada, though.
Oh wow.
Yeah.
What part?
Toronto.
Oh, I love
Oh,
Toronto.
that's a nice city.
Yeah.
It's beautiful.
Now, how come we come here?
I went to school here.
Okay, so you work for the VA, they pay for your school?
No, so I graduated med school 2 years ago. I work at the VA in upstate.
Do they pay for your loans, student
Now
loans?
I have 300,000 in loans.
Where did you go to school?
Upstate.
Oh, you did.
Yeah.
Okay.
Yeah.
Wow. And they didn't.
300,000
Holy
loans.
God,
Yep.
that's
Did you
insane.
go out partying on the money?
I did not, and I have a lot of interest here. All right.
How many years?
So 4 years of college, 4 years of med school, 4 years of ophthalmology residency training.
Oh my gosh, 12 years.
Yeah.
Wow.
How much do they gotta pay you a couple $100,000, make it worthwhile, right?
The older guys get that much money. I don't.
Why? Because, why don't you?
I'm still technically in part of training.
Ah,
Yeah.
that's something
Oh,
that they
jeez.
fall over your eyes.
Yeah, they give me this badge, but I'm still in training. Yeah.
But once do you get through training before you die?
Yeah, I'll be in my, I think, late 30s.
Jeez.
Then you bring in the big bucks?
But then, by then, I'll have $1 million in debt.
I know. I
Well,
hear ya.
What kind of interest do you have to pay?
7.5%.
Ooh,
Isn't that crazy? And here,
Biden is trying to eliminate that. Did he eliminate your?
No.
Who did he eliminate? That's what I'm trying to
lower in low
Yeah,
income.
yeah. I think I make too much money. I make 15
Right.
an hour.
Yeah.
Alright.
Yeah.
All right, I'll
Where-
get that.
His
Yeah.
granddaughter, my daughter,
Yeah.
she was forgiven because she was, under the income.
Yeah.
Now she's above the income, but
Yeah.
doesn't matter right now. You have to pay it back right now.
Married?
Yeah.
What's she do?
She's also a doctor too.
Does she have 300 as well?
Yeah.
Oh my God.
600,000.
Except she'll be making the big bucks next year, so hopefully.
What does she do?
Cancer, oncology.
Oh, okay.
All right.
Wow.
I'm so sorry, man.
No, you're okay. It's not. Any questions, by the way?
Well, what do we do? Are you going to send somebody in today to talk to him about this?
Yeah. So I'm gonna talk to Dr. Grunstein.
Okay.
See what he thinks. He might ask you to come back to a glaucoma clinic where a glaucoma specialist evaluates you.
Okay.
Does he need? Does it have to be done today?
No, so that won't